And that's where we're going to leave Michelle Andrews and Zara, the creators of the podcast Shameless. And we're going to take you now to Melbourne, where the Premier, Daniel Andrews, is speaking and giving us an update on the latest coronavirus numbers.
That is 76 new cases since yesterday. I'm sad to say that there are now 661 Victorians who have passed away from this global pandemic. That includes 6 deaths that occurred yesterday, that is, or in the last 24 hours, and 5 deaths that occurred prior to yesterday but in recent days, and the Chief Health Officer can speak to that in just a moment. Those numbers are being reconciled as they come to us. We report them as soon as we are in a position to do so. I can go through some breakdown of those numbers. 1 male in their 60s, 1 male in their 70s, 2 males and 2 females in their 80s, 2 males and 3 females in their 90s. And again, we extend to each of their families our deepest sympathies, our condolences and our best wishes at what will be a very, very difficult time. 10 of those 11 deaths are linked to aged care outbreaks. There are 298 Victorians in hospital. 21 of those are receiving intensive care and 15 of those 21 are on a ventilator. A total of 2,372,112 test results have been received since the very beginning of the pandemic. That's an increase of 15,820 results since yesterday. There's some 4,370 cases with an unknown source, an increase of just 1 since yesterday. There are 286 healthcare workers who are active cases, and the total number of active cases across the state has now fallen to 1,956. In terms of the metro-regional split, there are now 102 active cases in regional local government areas that are under stage 3. That number continues to fall. That's very pleasing. Those numbers are low and they need to stay low. And thank you to every single person across regional Victoria who is playing their part in achieving that outcome. Colac, there are 23 active cases, 6 new. Greater Geelong, 21 active cases. Greater Bendigo, 6 active cases. Ballarat has just 2 active cases and no new cases. That is to say that those numbers show that those communities that we had significant concern about some weeks ago, when, for instance, there were more than 500 active cases across regional Victoria with a real concentration in that Geelong, Ballarat, Bendigo, those regions, those numbers have come right off and we are very pleased with that. In terms of active cases in aged care, there are some 944 active cases across aged care. Active cases in disability facility settings, 24. That's a decrease of 6 since yesterday, and the breakdown of those 24 is 12 in staff and 12 in residents. So essentially, it is good to see these numbers continue to fall. It is good to see that the strategy continues to be successful. Obviously, at 76 new cases, that is still a really significant challenge for us. And to open up with those numbers would, of course, see the total number of coronavirus infections explode. It would see many, many hundreds, indeed thousands of Victorians infected with this virus. So, as frustrating, as challenging as it is, we need to stay the course on this. That's why tomorrow we will outline a roadmap to ease these important restrictions, to ease out of the second wave once it's appropriately and properly defeated, truly defeated, so that we can be sure that the settings we lock in can be defended. That is, our coronavirus detectives have got not just a fair chance, but there is a strong likelihood that they are able to actively suppress cases, because there will be outbreaks, there will be hopefully very small numbers of additional cases in the weeks and months to come, but that's got to be a fair fight. Pretending that any contact tracing team anywhere in the world could keep numbers low when you start from a high base, particularly a high base in terms of mystery cases, that doesn't do any of us any good. I want to thank Victorians for the way in which they are following these rules, the way in which they're all making a really important contribution to a strategy that is working, and to a strategy that in its totality will give us a COVID normal that we can lock in, so that as we look to Christmas and we look to 2021, we have every confidence that we can have a stable set of rules, that we can find that COVID normal, that we can save lives and livelihoods, that we can open up and stay open. Not be open for just a few weeks, but be open for as long as it takes to see this thing off until a vaccine arrives. That is the strategy. Yesterday I made a couple of comments about how heartbreaking and how very concerning it is to have so many people in the business community, for instance, very keen to open up quickly. I understand why they want to do that. It's not just for profits, it's for their people, their staff, their future. I absolutely get that. But when you really think about it, I don't know that any business, my own experience, my family background, and the people that I speak to almost every day, no one is really advocating to open and be open for just a few weeks. And if you opened at these levels, that is exactly what would happen. It would be 5 minutes of sunshine and then a third wave that arguably will be even more devastating than the second. We just have to find a way to be as steadfast as this virus. It is stubborn. The tail of the second wave is a stubborn thing. And we are seeing these numbers come down. I'm deeply grateful and very, very proud of every single Victorian who's playing their part. Just before I throw to Brett to talk about the epidemiology of the day, I do just want to again make that really important appeal to any Victorian, regardless of your background, regardless of your circumstances, regardless of your postcode. If you have any symptoms, even the mildest symptoms, as soon as those symptoms begin, please go and get tested. It is critical to us having the most complete picture of where this virus is, how it's presenting. It gives us the best sense of what we're up against, and that means we can make much better decisions to find that lasting COVID normal that can only be found after we have a slow, steady and safe easing. That's what's got to be done here, and that's what we will announce in detail tomorrow. I'll now throw to Professor Sutton.
Thank you, Premier. So an ongoing slow and steady decline. It is heading in the right direction. It's too slow for all of us, I'm sure, too slow for me, but it is going in the right direction. It is some light at the end of a very long tunnel. The cases in Colac are the only regional cases today, so we will, I'm sure, see a continued decline in the number of active cases in regional Victoria and a lot of local government areas in regional rural Victoria that will not see further cases. That said, there might be cases out there, so do not be complacent and think that there isn't a possibility of cases being introduced into your postcode if you're in regional Victoria. Get tested if you're symptomatic. In Metro Melbourne, the cases are concentrated in just a couple of dozen local government areas. So again, there is a focus in terms of where transmission is occurring, but single cases occur pretty broadly across Metro Melbourne, and anyone can move across Melbourne for essential purposes. And so there is always the risk that even if you're in a local government area that has no cases or very few cases, that cases can be introduced there. So again, if you have compatible symptoms, a runny nose, a tickly throat, headache, cough, fever, please get tested. We've seen reasonable numbers of testing in the last couple of days, but we do need to keep that up. We need to understand where every single case is across Melbourne and the whole of Victoria. Happy to take questions.
Professor Sutton, which of those local government areas are you seeing those clusters still in?
So they're still in the north and west suburbs of Melbourne, as well as concentrated around Dandenong and Casey local government area. But it's a handful of new cases each day in all of those local government areas. So it's not huge numbers. We know it's not huge numbers. We've got 64 as an increase today with the reclassifications. But those few cases are spread out across the north and west and the southeast.
Professor Sutton, we're going to have 2 more weeks of stage 4 restrictions after the 13th of September.
We'll be talking about that tomorrow.
64 new cases with the reclassification. Only one is a mystery case. How many of those new cases are in healthcare workers and aged care workers?
So I can't tell you for the numbers that have just come through overnight and late yesterday, but the healthcare workers make up about a third of our totals in recent days. So that's aged and acute care and disability. Although the disability sector's really seen very few, if any, new cases and a decrease in active cases. About a third are close contacts of known cases, and the remainder are under investigation or mystery cases. But the mystery cases are about 10 or 15%, remain at 10 or 15% in recent days. And if today's numbers keep that trend going, it'll only be half a dozen.
You said the decline is too slow for you. Can you expand on what you mean by that?
I have the same desires as everyone else in Victoria and across Australia. We want to see this disappear. We've been so very patient, but it is hard yakka. There's no question watching it come down from 725 on one day and to see it drop by 100, but to get to these smaller numbers and to see it only drop by 5 or 10 each day, I can understand that impatience. I feel that I'd love to see it drop much faster, but these are the most difficult chains of transmission to get on top of. That said, there are still preventable transmissions occurring. So, people who are gathering who shouldn't be gathering together, that's causing little clusters. And if we can get on top of those, they're 5 or 10 cases each day. We could get on top of this even faster. So yeah, I've got some impatience about not being at zero, but I am realistic about the fact that there are lots of efforts that need to be made across lots and lots of different areas to really crush this.
Is there a point where health authorities just accept that we won't be able to successfully suppress the virus below a particular number? Is there a time frame, or is it just see how long we can go until we can get it below, say?
Yep. We have to live with the reality of what we can achieve. We know that we're doing absolutely everything. If we get to a low number and it doesn't disappear, we will just work to keep that number low in the long term, but we have to get to a number that is sustainable to suppress in the long term. Because as the Premier says, no one's looking for a third wave, no one's looking for another lockdown, and we absolutely need to get to a level and keep going until we get to that level that we can be confident that we're keeping it there for the long term, for months and months.
Is this a situation of delayed gratification? If we really knuckle down for another couple of weeks, we're going to win?
Yeah, we're on the winning stretch now. There's no question. This is the last gasp of the virus, and we need to work harder than maybe we've ever done before to make sure that last gasp is indeed the last one. Because being on the other side of that, there'll be significant rewards. It's not, this is not behave yourself or else there are no rewards. This is just the reality of this virus. If we can do everything that's required now, we will drive those numbers down and we will get to a point where we can keep them down.
What is the current reproduction rate?
I don't know. It hasn't been calculated again in recent days. I think I said yesterday it's not so significant when we're down to very low numbers. It can have a very broad range in terms of the calculation, but I think it's around the 0.8 mark. There are calculations that are done by different modelers. They've all been in the 0.8, 0.85 kind of range, which means it continues to go down.
There are calls from some epidemiologists today to have a two-pronged approach. They're saying that you can't keep all of Victoria locked down when the spread is largely between healthcare workers and their immediate contacts. What do you make of those calls for a two-pronged approach? Well,
it's not incompatible with what we're doing. We have a strategy that's absolutely focused on aged care. That's what the VARC is working on. We have a strategy that's working on healthcare transmissions that is entirely focused on the actions and implementation that's required there, and we have the broad measures for community transmission. So they're all being put together as part of getting on top of this. And as you know, there are separate roadmaps for rural and regional Victoria and Metro Melbourne. So they'll all be focused appropriately based on the specific challenges. That's true for the kinds of transmission that are also occurring in high-risk workplaces. They are each tailored to the particular challenges of those transmission settings.
What they're actually calling for, though, is vastly different to what we currently have. They're saying let everybody else effectively open up and move somewhat more freely, while healthcare workers are still monitored and aged care workers are still monitored closely. It is very different to what the vast majority of Victorians are currently doing.
Well, certainly from the epidemiology that I've seen, there is no definitive dividing line between healthcare worker infections and community transmission. Community transmission means that there are patients. Patients put healthcare workers at risk potentially. They certainly mean that staff who work in aged care can become infected and can bring virus into aged care settings, so that you can't just separate the relationship in transmission between community transmission and those other settings, and it works the other way. There are aged care workers who can take the virus back to their families, and their families can take it to others in the community. That has happened. So we need to focus tailored responses, but we have to recognise that they are all interlinked.
Professor Sutton, can you just confirm how many how many Victorians have died in aged care homes? I think it was 505 yesterday, so it could be something like 515 today, 10 out of the 11.
It is 515 today. Yeah.
Okay, so that means that 78% of Victorians who have died from coronavirus have died in aged care homes. Now we know this, and it's been all year basically that we've had this coronavirus. Do you think the strategy going forward should be just putting all our efforts into protecting the vulnerable in aged care homes, and at the same time really working on opening up for businesses who are struggling? So I know you previously said that the COVID doesn't really transmit as much in cafes as they do in households. So seeing as lots of cafe owners are struggling at the moment, do you think now the strategy should be getting them to open up and just putting a lot more effort in protecting, I suppose, aged care residents?
There's no question that we're putting a huge focus on protecting those in aged care. It's also important to understand that the real epidemic in aged care followed the epidemic in the community, and the number of new introductions into aged care facilities happened at the height of community transmission. And so getting on top of community transmission is protecting aged care settings. It's both the response within those settings, so making sure that it doesn't spread amongst residents, it doesn't spread amongst staff, and it doesn't go between staff and residents. But it's also about keeping on top of the numbers in the community, because the aged care outbreaks followed community transmission, and they're now a challenge to make sure that it's not reintroduced to prolonged community transmission. So yes, there'll absolutely be a focus in aged care. In terms of how we address risk in all workplaces, we are absolutely using those principles of what are the regulated environments that we can look at, where we can capture names, where we can make sure that people are spaced appropriately, where we can make sure that issues of ventilation and cleaning are all addressed. So those principles are absolutely being applied, and we recognise that indoor is more a risk compared to outdoor, where people are forced to be closer together. It's more a risk than those places where they're separated. Where there is a chill room, where there is high humidity, where there is low ventilation, they are high risk. All of those principles have been applied as Department of Jobs has looked at the risk across workplaces, and we'll use those principles to determine how we move forward.
So is it true or even likely that hospitality venues won't be allowed to have indoor dining until there's been 2 weeks of zero community transmission?
Well, we'll speak to the roadmap tomorrow.
Is this 2 weeks of zero community transmissions realistic and achievable? I know WA's had a long stretch of zero community transmissions. Are there many cities around the world that we're seeing that that's happening? And the second part of that question, when do you think we might be able to get to that point?
I'm not sure when we'll get to that point. We're aiming for it. There's no question we're aiming for it. We may or may not be able to get there. We'll make judgments as we see the numbers each and every day. There aren't many places around the world that have got to those low levels. Most places around the world are dealing with thousands of cases at the moment. 25,000 cases in Spain a couple of days ago. I saw 8,000 in France on a daily basis. That's hugely challenging. If you reflect on what 700 cases a day meant for Victoria, you can recognise what that might mean for other jurisdictions internationally. So they're not at the kind of levels that we're getting to and that we're pushing to, but they're also not under control in terms of the transmission that they're seeing.
Can I just ask, why are you aiming for zero community transmission when it hasn't really happened that much around the world? We've been in lockdown for such a long time, so many people are struggling. Do you think it's really the most realistic aim?
We are just getting to a position where we get low enough numbers that we can sustain those numbers at the lowest possible level. It's not to say that we won't progress with relaxation of restrictions with some small numbers of cases. As long as we can sustain control of those numbers, that's the principle. The long-term sustainability of those numbers, that's what we're aiming for.
Experts and epidemiologists say that for moving between stages as opposed to setting dates, we need to move to thresholds of case numbers and things like that. Is that something you've been considering? Is that something we might see tomorrow as part of the roadmap? There
are certain considerations about having a threshold that relates to numbers, but it's not the only consideration. But absolutely, we're making those judgments on a daily basis, and we've always said that we're looking to get numbers to a certain level where we're reviewing them and looking at where it's headed and where it's at to be able to make those decisions. So, it's not about absolutely fixed dates for everything, for sure.
Is there a risk with those thresholds, genuine question, that people might say that you say we need 5 cases over a fortnight to move out, that people might avoid getting tested as much?
No, I don't think so. I think people understand that getting tested is the pathway out of here. Getting tested is how you identify cases and control this. Not getting tested is the equivalent of putting your head in the sand because transmission carries on. It'll be identified as people present to hospital, as people die. So there's no escaping the reality of transmission. Testing has to be the pathway to get on top of the cases that we know about.
Brett, do we know how many patients in hospital for other illnesses contracted COVID-19 there and potentially passed away as a result?
No, not in detail. I've asked the intelligence team to look into that, but it's a metric that we need to look into every single case acquired in health care to understand.
Premier, just a question on the... Can we ask you a question on the... Sorry, Brett. There are reports, and this has come from someone external, that some police members are covering their name tags and badges in preparation for the protest. Have you had anything?
No, I certainly haven't. I haven't heard that report, and I certainly haven't seen it. My vehicle was stopped on the way to the office this morning, and the officer was clearly identifiable, and I thanked him for the work that he and his colleagues are doing.
How many more police are out and about today? Can you talk us through? It seems like in the city there are cars getting stopped. Can you talk us through what's happening there?
There's a very visible, very significant police presence in the city. Some people have forecast that they intend to, in a selfish, dangerous and unlawful way, protest and put this strategy at risk. And police, I think, are taking appropriate steps to deal with that. As for numbers, I would leave it to Victoria Police to take you through that, and we can certainly get them to provide you with any details.
Tomorrow is a big day. There's obviously a lot of anticipation in the community. How heavily does that weigh on you and your ministers?
Well, look, these are very difficult decisions to make. In fact, these are the most difficult decisions that I've certainly dealt with in my 20 years in public life, because the tolerance for getting it wrong is very, very low. What we're trying to achieve here, and what I'm confident we will achieve, is not open for a few weeks and then we see hundreds, thousands of cases and we have to shut down again. It is about a steady and safe easing of these rules so that we can lock in a lasting COVID normal. Not for weeks, not even for months, for as long as it takes. For as long as it takes for a vaccine to turn up. That's what we're aiming to deliver, that's what we will deliver, but only if all of us, every Victorian, stays the course and doesn't, this notion that it's over because I want it to be over. I wish that was the case. I wish that was the case, but it's not. This thing is wicked. It is stubborn. It is silent, and it moves with such speed that unless we see it off properly, defeat it properly in the second wave, we'll be open for just a few weeks, a month maybe, and then it'll all be back again, and arguably it'll be worse than it ever was. And I would just make the point, it's a fair question in relation to protecting those who are vulnerable in aged care. That's a perfectly fair question. But I would just say this, there's a bit of a tone out there that, oh well, these people are all very old, and it's only having the most tragic impacts amongst those who are very old. Well, again, I'll make the point. If the health system is overrun, like it has been in New York, like it has been in Paris, like it has been in Spain, the list goes, like it has been in so many parts of the US, then it's not just COVID patients who can't get the care that they need. It's every patient who needs time-critical care. They finish up going into a system that is overrun and overwhelmed. That's just the fact of it. So we've all got a stake in this not getting away from us again. And we've all got a big investment for sure, but also a big dividend if we can find that COVID normal. And the only way you'll find it is to ease out of these restrictions in a steady and safe way.
So obviously there's going to be a lot of detail released tomorrow.
There will
give people any idea of what sectors you'll be talking about first? Is it construction? Is it
the best thing? I understand the interest, absolutely. Everyone is very interested. Those decisions have not been finalised yet. There will be meetings throughout the afternoon and well into the evening. There were meetings that went well into the evening last night. The only break from meetings is when I come here to speak to you. We will outline what we're doing in regional Victoria, what we're doing in Metro Melbourne, a time sequence, a series of triggers, all of which will be designed not to keep people locked in for a moment longer than they need to be, but instead to ease out of these restrictions in a steady and safe way so that we can then lock in a normal for many, many months.
Premier, what response will today's protest, what influence will today's protest have on those meetings late into the evening tonight and on the decisions that you announce tomorrow?
Well, again, I wouldn't want to be... That's a somewhat difficult question to answer, and I wouldn't certainly want to be sending any message other than this one. It is not safe, it is not smart, it is not lawful. In fact, it is absolutely selfish for people to be out there protesting. The only protest we should be engaged in, the only argument, the only fight we should be engaged in is against this virus. Let's not any of us do anything that might jeopardise this strategy. Let's not any of us do anything that might see more coronavirus cases rather than less. That's just not worth it. It's just not worth it. If you want to get out of these restrictions, as we all do, and stay out of them, that's the key point, get out of these restrictions and stay out of them, then we have to do this in a steady way. And that's what I'll outline tomorrow. Everyone will get a go. It's fine. Right up the back.
You've said right through this that the advice you've been taking on much of your decisions has been from the Chief Health Officer. Is that still the case with this roadmap, or will you be taking into account other industry leaders, stakeholders, etc.?
Well, this is a health problem in the first instance. And until you fix the health problem, there can be no economic repair. There can be none of the recovery that we absolutely want. And if you just break that down, it makes perfect sense. You can't repair the damage that this pandemic has done to our economy in 2 weeks or a month. You need a set of stable settings. You need arrangements that can last, that lasting normal. That's when you can repair. So, of course, industry feedback is important. We've done that right the way through, community group feedback, unions, workers. There's many, many people, thousands and thousands of meetings. But the advice on how to fix the health problem, which is that's the cause of all of the damage, comes from the Chief Health Officer and his team, and they consult widely, and they call upon expertise from lots of different quarters. We've had modelling it is a massive task, thousands and thousands of different inputs to try and simulate what case numbers will look like when you have various rules change at various points. That kind of supercomputing is really significant. So it's a health problem in the first instance, and it's guided by the best of health advice. They're a great team, and they reach out beyond to make sure that they're double checking, triple checking things so that they're completely confident we'll detail all of that tomorrow.
Premier, can I ask you about National Cabinet? Today, Anastasia Palaszczuk said that she wasn't on board with the hotspot plan to reopen borders by Christmas. How fractured is the National Cabinet, and were you aware that Queensland wasn't on board?
Well, I'm not here to speak to the positions of other states. Premier Palaszczuk and other First Ministers can make it clear what their position is and was and will be. That's entirely a matter for them. From my point of view, I wouldn't describe National Cabinet in those terms. National Cabinet has served us well. National Cabinet will continue to serve us well. There are some things that we all need to put aside, some of the things that sometimes occupy us, and instead of acting in those sort of interests, we act in what is undoubtedly the national interest. That's what's driven National Cabinet, and I don't see that changing. At the same time, though, I'll let the Prime Minister speak to those matters in more detail. He's the chair of that body. I'd just say that yesterday's outcome, from my point of view, the outcome in relation to having a freer movement of key agricultural workers and the process to improve those arrangements between South Australia, Victoria and New South Wales was a very important outcome.
So you wouldn't be disappointed if Queensland and WA were eventually separate to that process?
Well, Queensland have made it very clear that they're not opening their borders. WA have made it very clear that they're not opening their borders. And, I'm not going to provide a gratuitous commentary all the way down here from Melbourne. The best contribution I can make to getting borders across the country open is to get these numbers down. And that's exactly what we're doing every single day. And that's also why the notion of doing what might be popular, so listening to some of the loudest voices and saying, okay, righto, we'll just open it all up and it's actually all fine. There's no issue here. 2, 3, 4 weeks later, borders won't be open. In fact, they'll be shut harder than they ever have if we finish up with a third wave. I've never criticised other states for closing their borders. I know it's difficult for those communities who live along those borders. Absolutely, I grew up not far from that border. I know how difficult it would be. At the same time, though, we would perhaps make the same decision if circumstances were different. And who knows whether circumstances might be different. This is not going to be over quickly. It's going to run for potentially a long time, well into 2021. Who knows when that vaccine will come? Who knows how effective that will be? So finding that normal, where we can have the most economic activity, we can keep people safe, and we can have a stable set of rules that don't have to bounce around fortnight to fortnight, that's what we're aiming at. That's what we're aiming at. And from my point of view, when we find that normal, from a Victorian point of view, there'll be no need to close the border to us. We'll then be able to have some more movement, and I think that's a good thing.
Tony, what about the childcare exercise rule? Can you just clarify exactly what parents or first of all, is it a change or not? And what are the rules now?
So it's not a change in the public health directions. There's no new written directions, but there were questions asked about whether parents can go out with their child separate to their own exercise, and the clarification is really around that, and the answer is yes. For those parents who don't have an opportunity otherwise to bring their kids out as they're entitled to, for whatever reason, commitments at home and with work, then they can have that time with their kids in a park or whatever for an hour, as well as an exercise period, again following the rules for themselves.
And I've got one more from mothers and fathers. I know we're opening the roadmap tomorrow, but our playground's going to be open.
You will know very soon. You will know very soon.
Professor Sutton, we learned in the draft report on Thursday, we know it was a legitimate draft at some point, the idea of bubbles for individual people living alone, but also for home visits, picking one other household was discussed in that plan. Can you talk us through the logic behind that?
So again, we'll make announcements tomorrow. I haven't even seen the draft that you're referring to. I don't know if it's accurate or not. But the principle we've talked about is that you limit the number of people that you interact with. That's a lower risk than opening up to a different individual every day. That's the bubble principle. It's been under consideration. It'll be spoken to in time.
How can you enforce something like a bubble system?
Look, we a lot of these aspects rely on people knowing what the right thing is and doing the right thing. Of course, there are instances where people have reported on behaviours that aren't up to scratch, or people being found out. But there's a significant part of everything that we're achieving, which is just people knowing what the right thing is and doing the right thing, and that's half the battle. And Victorians have done a superb job in that regard.
Just on mystery cases, is there any consistency to the type of people that are catching the disease from an unknown source in the community? Are they mobile workers, for example?
I would have to come back to you on that. I don't know that I've got it all in front of me. I think they broadly represent the same demographics that we're seeing in all of our cases. But obviously the cases that are linked to outbreaks have the professions where those outbreaks are occurring. So they are in aged care, they are in the higher risk industries. So some of the other individuals might be similar in terms of location, in terms of age group, but they won't have the same work demographic details.
How many of those mystery cases did we have over the last week?
So it's been around 10 or 15%. So, if you're looking at under 100 cases a day, it's in the 10 or 15 numbers on a daily basis.
On mystery cases, so when we went into, I think I've asked this before, but just when we went into...
You may.
Just how do you feel about them? Because when we went into stage 4 just a month ago, there was 760, and I know now it's well over 4,000. Was it 4,200? How do you feel about it?
Well, we're driving them down. As we're driving total cases down, those mystery cases are being driven down. The focus on them from a epidemiological point of view is that we need to try and understand where they might have acquired it as much as we possibly can. That's clearly apparent for clusters and outbreaks where we can see that where people have picked it up, contact with a known case. But for mystery cases, we really want to explore where they might have gotten it from. And there is serology testing, so the blood testing, not just the swab testing, where we can look at the people that they've potentially acquired it from, the people that they've been in close contact with in the 2 weeks before they became unwell, so the acquisition testing. And you can do blood tests, and it might be family members who never really developed significant illness, never got tested. It might be workmates. And if you can do serology testing for them and understand that that's where they've picked it up, then you can do broader testing in those settings. So it is important to try and dig down to those mystery cases as much as possible. But they're coming down as the total cases are coming down. And they will be, they'll be subject to the same pressures that reduce transmission as everyone is. So the limitations in movement will limit the mystery cases in the same way.
So do you think we're in a better position than we were a month ago, even though we've got 3 times more number of mystery cases recorded? Yeah,
they're just the mystery cases that have been gone through that full investigation, so that we understand out of our total which ones are the mystery cases. But we're unequivocally in a better position because we've got single figures that we're heading to for mystery cases. That's a terrific position to be in.
People who live alone in single-parent households are struggling is something you've spoken about before. Do you want to give them any hope ahead of tomorrow that they'll be looked after?
Only to say that we have always been cognizant of those struggles. We've always done this really difficult balancing act, understanding that we have to drive transmission down to the fullest extent possible. That's why these restrictions have been so strict, because stage 3 restrictions were turning the curve, but weren't doing enough, and we would have been in a position today where we'd still see hundreds of cases rather than double figures. And so those struggles for single parents, people living alone, are in our minds, absolutely. But we are balancing the need to control transmission to the fullest extent possible with a recognition of those really significant struggles. So, yes, we've heard people we're working through all of the next steps with those struggles in mind, as for many other sectors. And so if I can give that assurance that that's front and centre in our thinking, and all of the other struggles for people psychologically I'm happy to give that assurance.
Professor Sutton, you said before Victoria's potentially at got the hardest task ahead of it. Is it safe to say then that Victorians shouldn't really be expecting any sort of significant easing of restrictions tomorrow? Not tomorrow. An announcement of easing of restrictions for the next few weeks. They should brace themselves for a few more weeks of pretty hard lockdown.
What I really mean by the hard task is that it's holding the line. When we get to very low numbers, people might consider that we're through it, that we can change our behaviours, that the risk isn't there anymore. And so the really hard efforts that I'm referring to are the efforts of bearing in mind that until we're really through this, that the risk will remain, the risk of resurgence will remain, and that will be awful for everyone should it happen. And we have to have that. We have to have that steady approach to be able to get there. And that steady approach is not just what we map out, but how people respond to it, how people ensure that they're still wearing a mask, ensure that they're still getting tested, ensure that they're still isolating as soon as they're unwell. That's what I mean by the hard yards ahead of it, because there is, at an individual level, there must be a sense that you just want to get back to normal. And so I just say hold the course.
Is there a worry then that when we do get through it, so to that point where you just referred to, through the worst of it, that people will then go berserk and we will see cases, we've seen New Zealand, get to zero and then come back, and the same sort of happen around the country. We've seen cases pop up. Is there a concern then that because we've had such a long, hard lockdown, people will actually just go nuts?
I guess there is a concern. I have that concern. I don't think it'll happen. I think people understand. We've been through this. We've gone through a first wave. We were on the other side, and it all came back. And so I think people understand how awful it is to have a resurgence and what it means for our health system, what it means for our economy, what it means for our individual lives. And so I hope that's still in people's minds, and that there isn't that immediate push to just normal behaviour, because that does put you at risk as an individual, puts all of us at risk.
Just on that, how confident are you that this is kind of the tail end, and that if we do keep with this strategy, then there won't be a third wave when there has been cases pop up around the world and around Australia, and we might not know about it?
Yeah, everything we're doing is working on that principle, that this is the tail end, that we are working to a future where this virus remains under control for the long term, because we can't afford it, no one can afford it globally, to have a huge resurgence. So we need to keep it under wraps until a vaccine is available. There are over 30 that are in those phase 3 trials, with tens of thousands of people, hundreds of thousands of people around the world now going through phase 3 trials, where we'll see what a vaccine might be able to achieve. And if just one of those vaccines, and there will probably be 3 or 4 or more of those vaccines that show effectiveness, that are safe and can be produced, that's what we're hanging out for. And so if we can do that and hang on for those months ahead, when a vaccine's available and can be provided across the population, then we're all in a much better position.
We haven't been able to control the virus for most of the year, so there's no doubt in your mind that this will happen again next year.
I think we still know what works in terms of control. We've seen it get away for sure, but we also know that these numbers that are going down day by day are in response to the very things that we have in place now. And we know that the contact tracing system is stronger than it's ever been, and more timely than it's ever been. We need to work on all of that. We need to work on getting numbers down further. But yes, I'm confident that when we get to those single figures, that they'll remain there, if not go down further.
This roadmap is people's mental health and, I guess, the invisible effects of a lockdown being taken into consideration, because obviously Melburnians, Victorians have been in lockdown for an extended, long period of time. Are you concerned that an even bigger extension would have a more significant effect on that, and are you considering it in this roadmap?
Yeah, absolutely. So effects on mental health. We've talked about the risk of domestic violence. We've talked about access to medical care. All of those things are in mind. And of course, all of the consequences of not working, of not having the economic activity that supports people's lives and livelihoods. So yes, all of those things are in mind. Safer Care Victoria, our Victorian Agency for Health Information, Cabinet more broadly with all of their relevant departments are looking at those data metrics and hearing the stories, not just numbers on a page, but knowing the very real effects of this. So yeah, it's in mind. It's an absolute consideration.
Can I ask the Premier a question, please? The federal government put out a roadmap in May, I believe, of the stages of moving out. As this week has progressed, you said you've been speaking to the Prime Minister a bit. What's his feedback been to you on Victoria preparing its own roadmap to move out of this second wave?
Well, I think the placemat you're referring to was the National Cabinet agreed time frame, so different phases, with an aim of everyone being to that COVID normal by July, if my memory serves me, in relation to that document. Look, you know, whether it's me or the PM, any of our colleagues, indeed people right across Victoria, we want this to be over. But I think there is an acknowledgement that it's got to be done properly, and a few weeks of a sense that it was over when really deep down you know that you haven't defeated it, and it'll be back, and it'll be back worse than it's ever been. So I'll continue to speak with the Prime Minister. We're very grateful for the partnership. I'm very grateful for the partnership that I have with him and his team, and I think that has served Victoria well, and it will continue to. And of course that's in the national interest, given if you look at the economic performance of this state over the last 5 or 6 years and the profound contribution, well above our population share, whether it be in terms of creating jobs, creating wealth. We want to get back to that position, and we'll get back there, not by pretending it's over when it isn't, but by properly defeating it and then locking in a lasting COVID normal. And you'll only find that, and you'll only safeguard that for the long term, deliver it for the long term, if you open up in a safe and steady way.
Why is it that Victoria needs its own new specific roadmaps now? Is it because the second wave is presented so differently to the first wave? It's a very different.
The second wave, in so many different ways, is very different to the first wave. We're not unique in that. If you look at second waves in many different countries around the world, they've presented in different ways. It's got into communities, it's got into settings that it perhaps didn't get into in the first wave. So, you know, each of these are, in many respects, a unique challenge, but there are trends right across the world. And I think trying to use the toolkit that was appropriate months and months and months ago, when it was about return travellers, and was not so much about high-risk workplaces, large families and the interplay between those two. We didn't have community transmission anywhere near the level we do now. That probably wouldn't work. And I must say there's no sense from the Commonwealth in any of the discussions I've had that we have to use something that was relevant 3 or 4 months ago. I think what they're feeding into and what they expect and what they and all Victorians will indeed get tomorrow is a plan that is steady and safe and will deliver a COVID normal that can last months and months, not just weeks.
Questions, please.
Always said you want to be confident and certain when you announce your roadmap to recovery. Are we in the right place now with 70 odd new cases today? Are you confident?
I am confident, and we are in the right place to detail a roadmap tomorrow. But it's got to be a roadmap for regional Victoria and for metropolitan Melbourne that delivers a COVID normal that can last.
What time is that, Professor? Everyone wants to know.
I'm not certain yet, but as soon as we can block that in, we'll absolutely let you know. I think the footy's on at 3 o'clock, I think, so it won't be there.
Premier Jeff Kennett, the former Premier, has come out today and he's been questioning the death toll in aged care and other places, saying that he thinks these settings are conflating people dying with COVID to dying from COVID. What do you make of that, and what do you make of that rhetoric?
I've got absolutely nothing to say about anything that person says. Nothing. But to Victorians, can I say this? Every Victorian has given so much, and I want all that you have given, all that you have done, to mean something. And it will mean nothing if we open too much, too fast. We've got to do this in a safe and steady way, and we will, so that we can have a COVID normal that can continue, not just for a week or two to defeat this virus, but a COVID normal that can defeat this virus for the long term. That's what we're aiming for, that's what we'll deliver, but it just can't happen. It's impossible to get to that point if we open too fast. We've got to make sure the sacrifice and the pain and everything that every Victorian has given, we've got to make sure that counts for something. That's what's guiding me, as well as, of course, science and data and safety. Not about being popular. It's not about being popular at all. It's about doing the right thing and making really tough calls, the toughest I've ever made. But that's the job. That's the job. You don't get to do the things that might make everyone happy. You've got to do the things that will keep people safe and allow for lasting recovery, sustainable recovery, jobs and security and profits and well-being in an economic sense that's there for all of 21. This Christmas needs to be as close to normal as possible. And I won't put that at risk by doing the short-term popular thing. We're going to do what is in the long-term interest of this state. It's the only option. The only option. We will be back tomorrow. I'll let you know when that is as soon as that's finalised. If there's no other matters, thank you all very much.
Thank you.
And listening there to Victoria Premier Daniel Andrews and Chief Health Officer Brett Sutton from Melbourne with an update on the latest coronavirus figures in the state. 76 new cases in the last 24 hours and 11 deaths recorded. Of those, 6 deaths in the past 24 hours and 5 deaths in previous days. 10 of those 11 linked to aged care. We will also be having special coverage of the Victorian Government's roadmap out of lockdown announcement. That will be from tomorrow morning from 8 a.m. Australian Eastern Standard Time on the ABC's News Channel. New South Wales has recorded 5 new cases of coronavirus today. One of the new cases is a person in hotel quarantine, while the other 4 are linked to a cluster in Sydney's CBD. Meanwhile, Liquor and Gaming New South Wales has named Bondi Bowling Club as the state's worst venue to date for breaches of COVID-19 restrictions. Inspectors say there were multiple group bookings of over 10 people, no social distancing in bar queues, inadequate sign-in processes, and staff not enforcing mandatory measures. The venue has been hit with a double fine totalling $10,000. Queensland has recorded 1 new case of COVID-19. Premier Anastasia Palaszczuk confirmed the number over Twitter, saying the case is a close contact of a known case. There are currently 26 active cases in the state.